Okay, I appreciate that. Thanks for the opportunity to participate in this today. My name is Jeff Balistriere. I work for UnitedHealth, and I've been working with Shoreline Credit Union for since the last fall or so. And what my main role is to help people that have Medicare plans to take a look at what they currently have. As a Medicare, if they have a Medicare plan, just to do an analysis, because there's a lot of different plans that are out there. Make sure that they're set up properly. Also, there are people who are aging in, we call it. They're turning 65 years old. They need answers to how Medicare works and what plan options do they have. And I can meet with them usually 90 days before they turn 65, or even I have people that contact me even a year in advance, and I kind of coach them and send them some materials and stay in touch with them. So that's a highlight what I do. I'm not going to bore you guys with a bunch of insurance talk and lingo like that, but I just want to let you know that that's pretty much what I do. I'm an outside agent with UnitedHealth, and what that means is that I actually meet with people face to face. You don't have to do this over the phone. So I meet face to face, but nowadays I can do it via email or we can talk over the phone, or we can meet at one of the Shoreline branches. And I've done that before in the past, or a lot of times I go to people's houses because that's where their medicines are at, and that's where they have their medical records and that. So, the audience today may not be all 65 or aging in, but I'm sure you have relatives that are in that age group. You have parents and aunts and that. There's many times where I can do an analysis and help them out with other things than just medical, things like dental and vision and hearing aids and transportation, and on and on and on. So that's primarily what I do. What I'd like to do at this point, Nathan, is just kind of go over how original Medicare works and what the cost could be if you weren't set up properly. And just so the audience knows that I'm not a one and done insurance agent. You'll get birthday cards from me. I'll stay in touch with you. You can reach me on my cell phone. From the hours 7 in the morning till 9 o'clock at night, I answer the phone, because a lot of times people, if there's an emergency situation, they have questions about where can I go or what needs to be done. I'm there, for the members. So I call people back right away. People like that services. So, anyways, with original Medicare, that's when people that, they turn 65, and as far as the cost of it goes, there's a premium for the Part B, that's for the doctors, and that runs $140 to $150 a month based on income. It could actually be more than that. If you qualify for Medicaid, the state of Wisconsin will actually pay for that too. But if you look at the first line, you go through this whole thing with original Medicare. Medicare pays about 80%, which leaves the people on Medicare with about 80% left. 80% of what? If you had a $10,000 doctor bill, you're going to have $2,000 bill out there. Plus, Medicare has deductibles out there, where you have to pay for doctor. When you see your doctor, there's a certain amount that you're going to have to pay, in order to even see the doctor, which is $198. And if you were to be hospitalized, you're going to pay the first $1,408 worth of deductible. So Medicare can get very, very expensive. And if you have an emergency care visit, that's going to run you 20% of the cost too. You're out in Colorado and you get the snow, you're going down the hill and you wreck your knee, and you be in overnight and you have emergency care visit, it can get quite expensive. So that's original Medicare. And with original Medicare too, they really don't provide a whole lot of dental or vision or hearing. It's just basic cost for your health, and you still need a prescription drug plan. So with UnitedHealth, what we do is we put these plans together. We give them over to Medicare, the Centers for Medicare and Medicaid Services. They approve these plans, and they say it's okay for us to offer these plans. And all the plans that we have are bare minimum of what original Medicare offers, but there's a lot more to the plans that we give to our members. Okay, so Nathan, if you don't mind bringing up the other screen.
Of course.
So now this is just a highlight of one of the plans that we have, okay, in our area. So this is a Medicare Advantage plan. This is probably one of my more popular ones. It's inexpensive. It's only $27 a month. You know, you still have to, let me back up just for 1 second. You still have to pay your Medicare premiums for your Part B, no matter what, and to be eligible for any Medicare plan. So this is a more popular plan. This one's $27 a month. We actually take care of the deductibles for you. So you won't have to pay, you know, that first $1,400 if you were to be hospitalized. What I like about this, they're predictable costs. They're costs that are already negotiated with the providers, and the co-pays are already set in stone. So if we just go through this for $27 a month, when you see your primary care physician, you're only going to pay $5 when you see that primary care physician. Once a year, you go for your annual physical, you won't even have to pay for that. Colonoscopies are preventative, mammograms, those are all preventative. So you won't have to pay a dime. We encourage people to actually get their physicals to make sure they're, you know, in good shape. There's also specialists, what I like about the specialists is that you don't have to get a referral. You know, with most of the plans that people have that aren't on Medicare, again, if you hurt your knee and you go to your primary care physician, he'll refer you out to a specialist. So you always need a referral with a lot of these other plans. With these Medicare plans, and this one in particular, you don't have to get a referral for that. You can go to the specialist right away. The inpatient hospital care, there's no deductible. You just pay a flat fee of $295 per day, and that's days 1 through 5. So if something catastrophic happened, let's say you're in the hospital for 30 days and that bill is up to $400,000, $500,000, the most you'll pay out of that bill is just under $1,600. Think about that. You know, it's not gonna, if you have a plan like this, you have the predictable cost of what it's going to be with the lower premium. So there's outpatient services. If you're diabetic, you get all your monitoring supplies with it as well. Ambulance, you just pay a flat fee of $275. Those Flight for Life, those are running $15,000 to $20,000. And again, you know, you start having to pay a percentage of the cost of that. It gets very, very expensive. There's also emergency care, which is worldwide. Emergency care with original Medicare, again, 20%. With this, you just pay $90, and that is worldwide. So I had a call 2 years ago. Somebody was in Cancun, Mexico, and the gentleman, the husband calls me up and he goes, "Hey Jeff, I'm in Cancun," and I like to have fun. I was like, "Well, why are you calling me if you're in Cancun?" He said his wife had some medical issues and they had to do emergency surgery on there, and they wanted to know if they had to get back to Florida. You know, like a Flight for Life back to Florida. But with this plan, you would just you have the emergency care worldwide, so they were able to take care of her medical needs. She got back safe and sound, and she just had a $90 copay. I could go on and on and on and on with what's all incorporated with these plans. You get vision with it, you get dental with it at zero copays. You get 2 cleanings a year. You get X-rays. That's going to save quite a bit. You also get over-the-counter benefits where you get $40 credit every 3 months. So that's or 4 months. It's $160 a year that you can order online, and they'll actually mail you, like vitamins and supplements and aspirins and Band-Aids and toothbrushes and toothpastes and the dental floss, all that stuff you get with the plan as well. There's also a nurse line. If you want to talk to a registered nurse, I really like this, especially with people who have a lot of prescription drugs. If you have parents out there or family members that have Medicare plans and they're on a lot of prescription drugs, that's something I can look at to see maybe there's a little bit better deal for them. Different plan for them. That's usually a hot topic. There's also the nurse line that they can call up. We have virtual medical visits, which is really nice, with what's going on now, where they can talk to a doctor, via through the computer or a smartphone. And the really nice thing about this plan too is the prescription drugs come in the package. It's all in the package. It's a Medicare complete plan. So everything that you have, between vision and dental and prescription drugs and emergency visits, it's all rolled into one plan. So that's basically what I do. And with these plans, it's not just a one shoe fits all plan. What I do is I'll sit down, I'll go down and look at all the prescriptions, talk to them if they're seeing any specialists, what doctors are they seeing? Are they doing a lot of traveling? Have they had health problems in the past? And just for our area, again, we have 8 different plans that I can look at and kind of set them up with that. And then if we need to change the plans, we can do that. There's open enrollment between October 15th through December 7th, where I can sit down again and do a needs analysis. And if we need to, tweak the plan a little bit, maybe put them in something different, that's what I am there for. So I can be reached. You can reach me, through Shoreline's website. There's a link on there, as far as that goes. And it has my phone number. It has my email on there. And like I said, if you need to get a hold of me, just please give me a call. There it is. Thank you, Nathan. That's my phone number on there. I got a cell number. So just please feel free to reach out to me. And again, if there's any questions, please let me know. But again, I appreciate the time. I feel we have a very nice partnership and a nice service with the Medicare options and somebody that can really help the members out that are, in the Medicare bracket. So I appreciate the time, Nathan.
Yeah, of course. I want to follow it up a little bit with Jeff. You'll see a little bit later in our presentation that we heard from our membership that we want more education on certain topics. And, we felt like mortgages and car loans, there's a lot of educational programs out there, but this was just something that was so different and so complicated and kind of out of the realm. It's a little unique that finding Jeff was perfect. And we've had a lot of very positive feedback on the service because it is unique and something different that people didn't even know it was out there. So if I could say it to anybody who's on the fence about, seeking help, it's well worth an hour-long conversation with Jeff. If nothing else, he's a great guy to have an hour-long chat with. So if nothing else, you're gonna have a good time. But I really appreciate the relationship, Jeff. And
thank you. Appreciate that.
As Jeff had mentioned, his information is on our website, shorelinecu.org. If you just look at this little wealth management button right above the Best of Lakeshore winner announcement, is the Wealth Management Medicare Planning. And you get a little information on what Jeff can take care of for you, including his Shoreline phone number and his Shoreline email address. So I know we haven't necessarily covered yet how to ask questions. Obviously, everybody's muted at this point. But if there are any questions for Jeff, you should see a little chat button on the bottom of your screen. You guys may type in any chat questions that you may have. We will answer them. We'll go a little bit more detail here once the annual meeting actually starts. But Jeff, are you sticking around or did you have to step out?
No, I'm good. I'm here.
Good. So thankfully, Jeff will stick around for the presentation. We've got the annual meeting in a couple of minutes. We'll go through the chat and the Q&A. So if anybody has questions throughout, feel free to ask them from Jeff. Thank you very much, Jeff. Appreciate it.
Thank you, Nathan.